Okay, so this is one of the cases that I had last night. Right lower quadrant pain with a mass. The patient is an 89-year-old Caucasian male who states that he was trying to get out of bed around 9 o'clock, and all of a sudden he felt this extreme pain in the right lower quadrant area with a mass. He feels like it is a hernia. He's had a history of two hernias repaired several years ago, and he has had a persistent hernia in the right growing area. And this time he just couldn't push the mass back. This happened roughly an hour and a half right before he presented to the emergency department. He has taken 2 tablets of Motrin, which didn't help. He states that the pain is 10 out of 10, non-radiating, and sharp in nature. He denies any nausea, vomiting, no fever, no chills, no diarrhea or constipation, no blood in the urine or stool. A little bit short of breath, but not that bad. And prior to this, he was in his normal state of health. No other complaints. And no recent travel history. Past medical history, congestive heart failure, myocardial infarct in 1996, renal insufficiency, aortic valve disease, cardiomyopathy, and hip problems. Osteoporosis. Past surgical history, he's had hernia repair times 2 remotely, and the most recent one was in 1996, and cholecystectomy, tonsillectomy. Status post hip replacement in May. Medications that he's on right now: digoxin, Lasix, Zetia, nitroglycerin, Motrin, Coreg, and aspirin. And social history: he denies smoking, no alcohol or IV drug use. He's currently living with his wife, who is 82 years old. They have a part-time visiting nurse and also a housekeeper who is helping with the daily activity. And they have 3 children together, and all are grown up. He used to be working at Chrysler, and he retired when he was 62 years old. They have no animals at home. Family history: his mother deceased because of stroke, and the father passed away because of prostate cancer. Physical exam. Vital signs: blood pressure 130/64, pulse 71, respiration 20, temperature 36, pulse ox 96, room air. And patient is well-developed, well-nourished male, non-toxic in appearance, no acute distress, and patient answered questions appropriately, is very pleasant to speak with, and patient was accompanied by his daughter and his wife. Head: normal cephalic, atraumatic, and eyes: pupils equal round, reactive to light, extraocular muscles intact, and oropharynx is clear, mucous membranes moist, no oral lesions. Neck: neck is supple, non-tender, no adenopathy, no JVD, and respiration is non-labored, clear to auscultation bilaterally, no wheezing or crackles. Cardiovascular: regular rhythm at this time, and distal pulses 2+, no murmurs, rubs, or gallops. Abdomen: abdomen is essentially soft, non-tender, and non-distended. However, in the lower inguinal region, there is a mass consistent with a probable a direct hernia. And also, in the GU exam, there is no hernia within the scrotal sac. The ring is open, and there is no surrounding erythema, but the patient is extremely tender in this area. It is unable to be reduced. Skin, no acute lesions or rashes, is warm and dry. Neurologic exam, cranial nerves 2 to 12, grossly intact without any focal, motor, or sensory deficit. The patient is alert and oriented times 3. Musculoskeletal, 5 out of 5 strength in upper and lower extremity bilaterally, and there is no joint tenderness or swelling.